But let me bring that open to our panelists now, our doctors who are joining us. Dr. Devaunshi Kaul is from Safdarjung Hospital, Senior Resident, Department of Anesthesia, is joining us. Also with us is Dr. Rajeev Jayadevan. Dr. Rajeev, to you first. You just heard that young guy over there. So happy to hear students like that. But, saying that make it tougher, but get the right kind of doctors into the system. What are your thoughts about the lowering of the percentile?
First step for our viewers, I'll say that is zero does not mean 0 marks. All right. I'll just explain how the marks are handled first in about 10 seconds.
Yeah.
Let's say you're selecting for a sports team and you're selecting based on height. You've got people from height of 5 foot to 6'3". So these are the candidates lined up, and the average height is 5'6". So as of now, people 5'6" and higher are hired. But when the seats are vacant, they are saying that one way to do it is to bring it down a little bit. So 5'4" also gets in, but they go through the same training. So that does not mean that people who at the lowest level or let's say somebody who scores what's called 0 marks are getting in. I know there are some nuanced exceptions here, but I'm talking about a general category here. So people should not be under the impression that doctors with 0 scores are getting in. It is just that instead of
but
those
the SC, ST, OBC reserved category, their minus 40 is a qualifier, right?
I know. I'm aware of that. That's a different category. That topic is social justice, and we are not going to get into that right now. Let's just stick with the standard NEET guidelines now. So we can always argue 2 ways. One is, should we allow all these positions, seats to remain vacant in all these postgraduate training centers? Or should we have people sit on the seats and complete the education? We can have arguments back and forth for both sides. But I will tell you my view. I'll take you to my MBBS class. So in my MBBS class, if you look at all the marks that were given out, there were people who at all ranges of marks. But when I look at our class 35 years since our graduation, or 40 years since our graduation, I don't see a difference in the quality of doctors at all. They've all gone on to become excellent doctors in various forms. Some are doing medicine. I'm doing medicine. Others are surgeons. Others are teaching. Some are in general practice. Some are in pharmacology. Others are in community health, and so on. So when I look back, in fact, we joke about this, saying that the marks really didn't matter. So I'm not saying marks don't matter, but here's an important distinction. Remember, MBBS requires passing 19 subjects. Thorough knowledge of 19 subjects are tested, and then only you get the MBBS degree. And then you go through another exam, which is NEET, the postgraduate entrance, and that is the person who walks into the postgraduate seat. Now, with the postgraduate seat, for our viewers, I'll say is there are some postgraduate seats that are very focused. Say, for example, if I want to teach anatomy, I would only look at anatomy, and it's very easy for me to focus on just one topic. Or if I wish to study ophthalmology, I can only look at ophthalmology.
I get your point, Dr. Rajeev. Yeah, I get where you're going with this, but the larger question is still, and we'll perhaps have the answer very soon, right? Today is when the phase 3 of counselling actually opens. That means by 26, 27 Jan, we should know how it's actually turned out. But Dr. Kaul is also with us. She doesn't exactly agree with you. Dr. Kaul, is this the right way to fill up those 18,000 vacancies, according to you?
So I'll counter sir on this fact that, as he said, that we study 19 subjects to pass MBBS. And if any person, any student, be it a general category or any reserved category, if he's studying 19 subjects and after 5.5 years of rigorous training, he's not managing to score even the basic cutoff marks in a NEET PG exam. It's not a basic entrance level exam. You're training to become a specialist in a country, in a medical healthcare system. If after so much years of so many studying so many subjects, if you cannot even manage to get that cutoff, and the cutoff has to be reduced to a mere minus 40 marks, then the whole point of reservation or even the whole education of MBBS, it's all failed.
It's killed. You want to respond to that, Dr. Rajeev?
I get what the doctor is saying, but the point here is when you are doing a postgraduate, you become very good at the subject you're focusing on. So that does not necessarily require a
But
very
it's not
thorough
just about
knowledge.
becoming good at the subject, no, Dr. Rajeev. It's about
Yes.
sincerity as a student that you have. If you've not been sincere for your 5 years of MBBS, not to score a basic mark and a cutoff in your PG NEET, then what is the guarantee that the next 2 years that you're going to be sincere?
Let me
that's
correct
the
you
question
there.
that's before us.
Yeah, I need to correct you there. This is not about sincerity. We are looking at people who have honorably passed the MBBS course through the rigorous curriculum and have gone through an exam, and we are debating the exact marks that should be the cutoff here. These are not failures. These are not.
Then
dropouts.
what is the point of the NEET exam then?
Yeah, the NEET exam.
Then tell me the
is
point of the NEET
yeah.
PG exam.
NEET PG exam is a gateway of entry into the postgraduate seat. See, if the candidate is not good, the candidate will not pass. All right. So there is.
But the
remember, there is an
the
exit
gate
exam
is
as
always
well.
open. If you're for
So
a particular
scoring a
category and you
-40
are
is failing.
scoring even 0, the gate is constantly open. It's hardly a gateway anymore.
That is not true.
It's as good as not
score
sitting
is
in
not
the
zero
exam.
there. No, the score is not zero. There is a screening tool. And if your score is 0, you will not walk into that gate. You will not.
What does that mean? Just explain that to me. And I know
Yeah.
Dr. Kaul wants to come in. I'll let her explain that, yeah.
No, I
Yeah,
mean, I agree with you, Sonal, because it's as good as not sitting in the exam.
Okay, but Dr. Rajeev, very quickly, I have last 30 seconds. What do you mean
Yeah.
that 0 is not enough?
Yeah, 0, as I mentioned at the beginning, if you arrange people according to their marks, 0 means average mark, all right? So we are saying, the new guidelines are saying you could score below average mark. It doesn't say 0 mark there. And for the general category,
0
you just,
percentile minus 40 from
Yeah.
what I know.
yeah, percentile
Out of
does
800,
not mean,
correct?
Yeah, percentile does not mean
So
0.
can you tell me SC, ST or any reserve category over there, and this is not against reservation at all, should not be perceived as that. I'm just saying for a reservation student, what is the lowest benchmark required for PG according to you?
I am not aware of I'm not updated with the SC, ST category. As I said, it is social justice, and I'm not going to comment on that. It requires a long discussion on SC, ST alone and not in 10 seconds.
All right. Dr. Kaul, I'll give you the last word over there. I want to understand from you, since you are the younger of the lot, please, apologies for sort of mentioning that, but just because you're the younger of the lot and we've seen consistent dropouts in the NEET PG examination, I'm constantly going back to the same question, why are there vacancies? A lot of people are saying that let's fill it through lower percentile, etc. I'm just asking, why are there no takers for NEET PG?
See, the kind of seats that are going vacant are mainly of the non-clinical branches and mainly of private colleges. Why this is happening? Because just increasing the number of seats is not enough. Most of the places there is lack of infrastructure, lack of faculty, maybe there is a bond, maybe there is less stipend. So people, they are not keen to join on those places. Maybe they're located in peripheries, so students don't pick up those seats. And as the kid in first from the quota said, that people want to go on for more clinical branches.
Yeah.
So non-clinical
So
branches.
perhaps some redundant branches that people don't want, and that's where all the vacancy is coming from. I have very little time, so I have to leave it there for the moment. Thank you both for joining us. And for the moment, good luck to all the kids who are appearing for the PG NEET as well. We'll say a wrap on this bulletin today. See you again tomorrow. Bye-bye.